Hello, I am Dr. Rajeshwari Janakiraman, Senior Endocrinologist at Manipal Hospitals Yeshwanthpur, Bangalore. Today I would like to talk about gestational diabetes mellitus. What is this gestational diabetes mellitus? In short form we call it GDM. It is diabetes that is detected during pregnancy. So some people do have diabetes before pregnancy. We don't consider that as GDM. So when the sugars are high in pregnancy, it is detected in first time in pregnancy, it is GDM. So why is it important to know about this? We know when sugars are very high in pregnancy, the baby can be affected. The growth of the baby can be more, that is more than for appropriate for that age, it becomes more, and the fluid around the baby can grow more also. All these can lead to premature delivery. So when premature delivery happens, then after the delivery the baby needs special care like ICU care, incubator or ventilator, because it's a premature child, it doesn't know how to breathe well, and the baby's glucose may not be maintained well, or its temperature cannot be maintained well. So there are multiple problems which need special care. For that reason, we have to detect and treat gestational diabetes mellitus. So what is the cause for this gestational diabetes? So during pregnancy, a lot of hormones increase in a woman's body. So in every woman it happens. However, some people who are prone for it, their levels are so high, the body, the insulin resistance that develops in pregnancy, the body is unable to overcome in them. They cannot produce enough of insulin to overcome this resistance. As a result, their sugars go high. Who are at risk of for developing diabetes mellitus in pregnancy? It is people who are overweight or obese before pregnancy itself, or it can be women who have polycystic ovarian syndrome in the past. Sometimes if they have had first pregnancy, they had gestational diabetes, in the next one also they tend to get that. People who have family history of diabetes, either parents, grandparents or siblings have diabetes, they are likely to get gestational diabetes mellitus. So how do we diagnose this? So usually we do something called glucose tolerance test or glucose challenge test, where the fasting sugar may be checked, and after 75 gram glucose, 1 hour post glucose and 2 hour post glucose, the sugar levels will be checked. There is a glucose challenge test where if the patient has come, after eating breakfast and all, we may not be able to do the fasting test. In that case, we call glucose challenge test. 50 gram glucose is given in that case, and after 1 hour we check the sugars. And there are cutoffs for that. Based on that, if the sugars are high, we call as gestational diabetes mellitus.